Usually when you get a medical diagnosis, there's this heavy expectation of finality. Like millions of people are told that type 2 diabetes is just this lifelong progressive life sentence.
Yeah, a one-way street, basically.
Right. But today, we're doing a deep dive into Dr. Jason Fung's The Diabetes Code, and, well, it completely flips that grim picture on its head. Today, we'll explore 5 evidence-based reasons why type 2 diabetes may be reversible, and 3 practical habits that support long-term metabolic recovery.
And to really understand why it's reversible, we have to look at what's actually happening inside your body, because type 2 diabetes is fundamentally a dietary disease.
A disease of, like, too much sugar everywhere.
Right, exactly, yeah. It
Like-
happens when your entire body just becomes completely overloaded with sugar. And that distinction is so crucial because it makes type 2 completely different from type 1 diabetes.
Right, because with type 1, your body actually lacks the ability to produce insulin altogether.
Precisely. So with type 2, the root problem is this whole body sugar overload.
Which means standard treatments seem, well, completely backward. I mean, using medication just to lower your blood sugar feels like taking Tylenol for a fever while you completely ignore a raging infection.
That's a perfect way to put it.
You're just hiding the symptom. You aren't addressing the cause.
You really aren't. And the way standard medicine hides that symptom is often by prescribing even more insulin. But if you think about what insulin actually does, it basically acts like a shuttle.
Okay.
It moves sugar out of your blood and shoves it into your cells.
Wait, okay, I'm genuinely confused here then. Because if my body is already drowning in sugar and, like, my cells are packed full of it, why on earth is standard medicine giving patients more insulin?
I know.
That just doesn't make any sense. It's literally like giving alcohol to an alcoholic to
What?
cure their hangover.
It really is. Because, you see, when your cells are completely stuffed with sugar, they develop what's called insulin resistance. They literally lock their doors to protect themselves from, taking in any more of this toxic excess.
Okay, so the cells are basically saying, we're full, no more, we're done.
Right, exactly. But standard treatment responds to that by flooding the body with extra insulin to forcefully break down those doors.
Oh, wow.
Yeah, it just shoves the sugar into your organs anyway, your liver, your kidneys, your eyes. And that metabolic overload is exactly what causes the long-term damage.
Right.
You aren't healing at all. You're just sweeping the sugar under the rug.
Wow. Okay, just let that sink in for a second.
Mm-hmm.
We've been treating a disease of too much sugar by forcing that sugar deeper into our vital organs.
It's wild. But the incredibly hopeful part here is what happens when you actually stop that metabolic overload.
Right, when you stop forcing the sugar in.
Yes. When you stop, your organs can naturally recover. Your liver and pancreas can literally unclog themselves of that stored up fat.
Which brings us to the whole reality of remission. Because this isn't just theory, is it? We're talking real results.
Oh, not at all. Remission is a highly realistic hope. And that's highly relevant for you listening right now, especially after the age of 40 when these metabolic issues really start to surface. We see it in real-world evidence all the time. Like bariatric surgery often reverses the disease in a matter of weeks.
Just weeks.
Yeah, essentially because it forces a state of severe fasting. And over in the UK, Dr. David Unwin achieved this incredible 46% drug-free remission rate simply by having his patients cut carbohydrates.
That is just amazing. So for the listeners, instead of just managing this inevitable decline, what can you do starting today? Dr. Fung lays out these 3 practical habits for sustainable metabolic healing. First, stop putting sugar in.
Right, which means significantly reducing your refined carbohydrates.
Second, eat real whole foods and natural fats. Think olive oil, avocados, nuts. If it comes in a box with a barcode, you probably want to rethink it.
Definitely. And then the third step is intermittent fasting.
But why does fasting specifically work so well for this?
Well, because fasting actively lowers your insulin levels. And when insulin drops, it signals your body to switch from storing fat to burning it.
Oh, I see.
Yeah, you're giving your body the physiological time it actually needs to unlock those cells, tap into the excess sugar stores, and finally clear them out.
So to tie this all together, type 2 diabetes is reversible because it's a whole body sugar overload. Shoving that sugar into your organs with extra insulin doesn't heal you.
Exactly.
But if you stop the overload, your organs can actually recover, making true remission possible. Combine that with cutting carbs, eating real food, and fasting, and you have a real path forward.
Your body was designed to heal. Sometimes the first step is simply removing what has been overwhelming it.
Did this deep dive change the way you think about type 2 diabetes? Let us know in the comments. And if you enjoy learning from the world's best health books, subscribe to Mosaic Health 40 plus Satellite. Please note this discussion is for educational purposes only. This episode was inspired by the Diabetes Code by Dr. Jason Fung and enriched with insights from the author's interviews, podcasts, lectures, and public discussions included in our research sources, because better health starts with better knowledge. Books, science, better health. See you in the next Mosaic Health 40 plus episode.
And just as a final thought to mull over, the next time you look at a chronic condition like insulin resistance, ask yourself, are we fighting a broken system, or are we fighting a brilliant protective mechanism our body built to keep toxic sugar out of our cells? It changes everything.